Iqbal, Deputy Dean of the Faculty of Pharmacy, Pancasila University, Mrs. Dr. Apotheker Nimade Dwi Sandutami, MCAS, and the Honorable NUSPS Staff Advisor, Dr. Yong Lantan, and also Head of SEMA FF-KMUP, Anastasia Aneta Maharani, and Chief Executive of the webinar Internasional, Sabira Salvabila, and good morning to all speakers, invited guests, and the participants. I would like to thank the committee who have also tried to prepare this event well, and also to the participant and invite guests who have taken the time to attend international webinar today. We give thanks to the God Almighty because thanks to His abundance of grace, we are still able to gather at international webinar today. Today, international webinars aims to encourage pharmacy students to learn about pharmaceutical and other health-related issues, as well to establish collaboration among pharmacy students in Southeast Asian region to advance the health sector, especially in pharmacy. That's all from me. Good morning. Wassalamualaikum warahmatullahi wabarakatuh. Shalom, peace be upon us.
Thank you, Mr. Zikri Nugraha, for those wonderful comments.
For the next opening remarks, will be delivered by Staff Advisor of IRC, Dr. Yong Lan Tan.
Hello everyone. A very good morning to everyone today. I'm Dr. Tan, the Staff Advisor of NUS Pharmaceutical Society. It is certainly my pleasure to be invited to give a short welcome address for today's webinar. As a start, I would like to thank all speakers for taking time off on this weekend to share and present for this webinar. And I'm elated to be seeing a very high turnout rate today. A very big thank you to all participants for having a strong interest in today's webinar. And hopefully you will gain valuable insights from today's discussion. I would also like to take this time to thank the heroes who are working very hard in the background to organize this webinar. Thank you to the students, professors of SEMA FF-KMUP and NUS Pharmaceutical Society for co-organizing this event. The topic of today's webinar is on lessons learned from COVID-19, and I thought that it is certainly very relevant and closely related to each and every one of us. With COVID-19 hitting the world on a global scale for the past 2 years and counting, with no doubt it has a widespread impact in every part of the society, be it the physical health, the public health policies, the healthcare landscape, the economy, and of course the list can go on and on and on. But one area which is often overlooked, and I thought is very interesting to be bringing up for discussion, is its impact on mental health. With isolation and quarantine measures in place, social distancing being enforced, limited gathering size, changes in the working landscape as people learn to adapt to work from home instead from office, all this limited social gathering and interaction, and all this undoubtedly have an adverse impact on the mental health of individuals. I hope we can all leverage on today's webinar to learn from the experts. And hopefully through the lessons learned, we can develop this resilience to adapt in future health crises. COVID-19 is certainly one big endemic in history, but it would not be the one and only one, and we can foresee new virus strains coming up in the near future. One of which is often reported in today's news is the concern on the spread of monkeypox. And with that, I wish the webinar a great success and may everyone enjoy your time in today's webinar. Thank you.
Thank you, Dr. Yong Lan Tan, for your insightful sharing.
For the next opening remarks will be delivered by the Vice Dean 3 of Faculty of Pharmacy, Pancasila University, Dr. Apotheker Nimade Sandiutami, Magister Kesehatan.
Thank you, MC, for the time. Good morning, ladies and gentlemen. It is an honor for me to welcome you to the international webinar. I'm very grateful to you, Dr. Yong Lan Tan from NUSPS and our esteemed Dean of the Faculty of Pharmacy, Professor Dr. Apotheker Samsudin, who was unable to attend today with us. I would also like to thank all the organizers for organizing this extraordinary annual event. I'm very pleased to welcome the participants who took part in this year's international webinar. This is very important for me to convey, considering that the Faculty of Pharmacy, Pancasila University, is working hard to achieve public recognition as a qualified faculty in implementing a better system. Furthermore, I would like to thanks to Mrs. Hesti and Mrs. Tan Weng Moy for being the keynote speaker at this international webinar. This international webinar with the theme Global Health Forum, COVID-19 Lesson Learned and Moving Forward. Of course, it will be useful for the development of pharmaceutical science in the future. This international webinar must be able to encourage students to understand more in the field of pharmacy and able to conduct research as well as implement its application to the appropriate technology. I would like to thanks to you, to your participation in this international webinar, with the hope that it will provide enlightenment for us, especially those who are always involved in research, learning, and application of pharmaceutical field in each of our lives. Finally, I hope we can continue and manage our relationship in any field between Faculty of Pharmacy, Pancasila University with NUSPS in the future. Thank you.
Thank you, Dr. Apoteker Nimade Sandi Utami, Magister Kesehatan, for those powerful remarks.
Now we'll be proceeding on to the presentation of souvenirs. For the handover of souvenirs, we would like to call upon Shafira Salsabila as the Chief Committee of International Webinar Collaboration, SEMA FF-KMUP at NUSPS to hand over the souvenirs.
The first souvenir will be given to Vice Dean 3 of Faculty of Pharmacy, Pancasila University, Dr. Apoteker Nimade Sandi Utami, Magister Kesehatan.
The next souvenir will be given to Dr. Yong Lan Tan as Staff Advisor of IRC.
Oh, thank you. Thank you.
Sorry. The next souvenir will be given to Dr. Yong Lan Tan as Staff Advisor of IRC.
Thank you. Thank you.
Sorry, MC, Dr. Yolatan, can we take a picture first?
Okay.
Okay,
Yeah.
1, 2, 3. Thank you.
The next souvenir will be given to Zikri Nugraha as the Chairman of BPM FF-KMUP.
Okay,
Thank you so much, Rizky. Let us take a picture first. Okay, 1, 2, 3. Thank you, Rizky.
okay, thank you.
The next souvenir will be given to Anastasia Anita Maharani as the Chairwoman of SEMA FF-KMUP.
Thank you, Anastasia Anita. Let us take a picture first. 1, 2, 3. Thank you, Anastasia Anita.
Thank you.
Ladies and gentlemen, let us begin our session with the first speaker. Let us invite Dr. Tan Weng Moy, PharmD, EMBA, to deliver the first material with the topic COVID-19 Impact on Mental Health. Before we start, allow us to introduce our speaker. Dr. Tan was Director of Operations at National University Hospital of Singapore from years 2000 to 2005. Following that, she was a Group Chief Operating Officer for China Healthcare from the years 2005 to 2006. Then she was the Chief Operating Officer for the Institute of Mental Health Singapore from years 2006 to 2010. And she was the Chief Projects Officer for National Healthcare Group from years 2009 to 2011. Following that, she was the Chief of Community Mental Health Care Division from years 2011 to 2019. And last, currently, she is the Director of InHealth at MOH Office of Transformation, presently. Before we continue on to our material, I would like to confirm, how would you like to conduct the Q&A, Dr. Tan?
I suppose we can they can write in, or we can just, unmute them, and I think that just a conversation. Is that okay?
Okay, sure, no problem. Yeah. Dr. Tan, please.
Okay, thank you. Let me just put on the screen first. Okay, can y'all see?
Yes, Doctor.
Yes, Doctor.
Okay, great. First of all, good morning, everyone, and distinguished guests, and all the pharmacy students, or shall I say, at least, the fraternity of pharmacy. I'd like to congratulate the organizing committee for doing such a very meaningful event for exchanges. I can recall when I was a pharmacy student in Canada, I used to participate in the different provinces in Canada. So it was quite fun when we were able to get together. Of course, while this is virtually, but I'm sure this will also help to improve the understanding of both sides of the practices. I'd also like to thank the committee for inviting me and give me the opportunity to share on the topic that is very close to my heart. So first of all, I also like to say that I have not been practicing pharmacy since, let me see, the last, when I was a head of pharmacy in KK, that was in 1989 until 1995. After that, I was more in the hospital administration, while in charge of allied health, including pharmacy, but not been very practicing. So I always tell people, only ask me if you need Panadol or Prozac, nothing beyond that, right? Or maybe penicillin, yeah. So today, I'm talking about COVID, bane or boon for mental health, as Ms. Tan earlier mentioned. A lot of times we talk about, all the stress, we talk about physical health, we talk about tiredness, but actually we don't really look at what is the root causes of all this and what will this lead to. And the reason I titled Beyond Healthcare to Health, including mental health, because first of all, many people think health as just a physical health. And even though we know, right, WHO says no health without mental health. And that's the reason I highlight this part of mental health. And also because of the fact that there's a lot of stigma about mental health, which I think, all of you will know as well. So for those of you who do not know, what is MOHT? MOHT stands for MOH, Office for Healthcare Transformation. It is led by our, can you all see the full slides, right? Just want to check. Can you all see the full slides? Just in case. Okay, good. Yeah, so it is actually our ED is Professor Tan Cho Chuan, who is the ex-NUS president and also the chief health scientist in Singapore. So we were about 4-year-old. The idea of MOHT is for us to see how we could bring about various stakeholders come together to transform the much needed healthcare system, that is so that we can be more person-centric, data-driven, just like COVID, right? With a lot of data, then we can make better decisions, and also look into how we could use digital means as a way to make it more efficient, effective, and very importantly is how do we provide value-based care rather than very episodic and very cash-based or insurance-based just alone, but looking at the whole system. So I'm from the Integrated Health Promotion, where we look into developing digital mental health solutions, as well as looking into better understanding of how the environment and social behavioral factors can impact individuals' well-being, including mental health and physical health. So suffice to say, I think all of you would have read in the newspaper, whether you're in Indonesia or Singapore. Apologize to my Indonesian friends over there. I only have the Singapore Straits Times and all that. We know a lot of teenagers are struggling, especially during the COVID period. And also mental health affects many of our teachers. And in fact, recently I just gave a sharing to a group of principals and vice principals in the secondary schools about how, they need to also take care of themselves. So for the students, be kind to your professors and your lecturers as well. They are extremely stressed out as well, And also in Singapore, during this pandemic, there was then the needs for them to relook into what needs to be done and how we can come together as a whole of government approach to address the issues of stress, work anxiety, and for the senior loneliness. And in fact, in one of the studies that was done by our Ministry of Culture and Youth to look into the youth part, because there's been a lot of unfortunate incidents of increase in youth suicide in absolute number. So there was, this survey that was done, even though it's about 2 years ago, but I think it still represents quite a bit of the stresses that the youth are facing. And in fact, if you see here, over half of the youth polled during the second half feel that they are very stressed out, and this is about their future, their finance, and also, of course, the academic and work performances. So the youth here actually include youth, from the IHL as well as those that transiting at work and new at work. In terms of cost, there's a lot of impact, right? If you were to look at some of the studies, 44% of Singapore actually, talked about the working culture, late and long hours. And in fact, I think recently there's newspaper and advocating for the fact that perhaps we all should only work 4 days a week. Yeah, I'm sure for students, you'll be very happy, right? I only go to school 4 days instead of 5 days. Yeah. So these are things that people are looking at. How can we help to have a better work-life balance? The stress that's related to illnesses, whether it's mental illness or physical illness, come out to be about 3.2 billion. IMH, which is the biggest tertiary psychiatric hospital in Singapore, also has done studies based on their Singapore Mental Health Survey back in 2016 to look into the costs that involved when somebody is having mental illness. And they look at the top 6 mental health disorders like major depression, general anxiety, all that. And it has a lot of impact in terms of cost. A lot of times we don't think about it, but a lot of people that I know of, when they are stressed out, they dare not take MC. Or they go to take MC because then they'll tell the doctor, oh, I can't sleep, I have diarrhea and things, but actually they have mental health issues. And some of them went to see psychologists, but they're not take MC because they're afraid the bosses will do some, the bosses will say that you're not good enough, then you have issues, then we may have to move you out of the job. So there's a lot of this costs that involved that's hidden that are not, being aware by many people. Now, with all this publicity, of course, there's also good, right? In the sense that people are much more aware. And the good thing is that they also create a lot of opportunities. More media means more awareness. And more companies, in fact, are now looking into how else can they be better invest in employees' mental well-being. In fact, our Health Promotion Board gave a lot of subsidized training courses for the supervisors, on the people, on self-care, and they have done a lot of campaign, including it's okay, right, to reach out for help and things like that, to hope that people can feel more comfortable to come forward for help. And so more people, especially the young ones, are more digital savvy. And I think in the sense, COVID has helped us and has helped in the sense that we have to force, right, to create and use digital solutions, unlike those days, face-to-face. Having said that, I just also like to share that, interestingly, when we do a focus group on the youth, many of the youth that told us, wow, it's nice to have digital solutions, but they also like to have a face-to-face to talk to therapists at times. So there is always a balance between having the digital solutions and having the face-to-face. But what is important, and it highlight the fact that people are now more willing to talk about it and come forward for treatment. Now, just to give you a little history in Singapore, what has been done in this area? So it started with like many countries. It is very institution-based. In fact, IMH has changed name many times. For those of you who may not know, yeah, it was, back in when I was IMH as the Chief Operating Officer, it started those days is being called Asylum, and then subsequently during the Japanese time, it was occupied and become a hospital. And subsequently, the name was changed to, instead of calling it psychiatric asylum, they call it Woodbridge Hospital. So for those of you who are, I suppose, some old enough, right, to know that there is, why it's called Woodbridge? Because there was a little wooden bridge at the old site of the psychiatric hospital. That's why it's called Woodbridge. They think that by changing the name, there will be less stigma, but lo and behold, Woodbridge is, when you talk about Woodbridge, right? And especially if you take taxi, those days, the taxi driver will then start tilting their mirror and start looking at you and wondering what you are doing there. But of course, today things are better. So when I have to take taxi to IMH, there's the third change name, right? Institute of Mental Health. The taxi driver will start talking to me about their stresses, right? So in the sense that I think people are much more open now. Now, after the institution when government starts to then embed in psychological medicine department in each of the public health hospitals, they launched the National Mental Health Blueprint back in 2007 to 2011. That was the time that I happen to be the Chief Operating Officer in IMH. That's where then we focus on working very closely with HPB and various partners in the community to promote awareness and mental health education from primary schools all the way to secondary and into the community as well. And there was also an effort to build up the capability of the social partners and our general practitioners, our GP groups. And of course, that's where the first Singapore Mental Health Survey eventually was conducted and came out in around about 2011. And then after that, in 2012, towards the end of 2011, the government felt that there's a need for us to embed mental health services within the community. And that was where, when I first started my journey, to have the privilege of doing the designing and conceptualization of how we could actually work on a different model beyond just working on professionals in the hospitals. So that's where we focus on how do we improve access to the primary care with the GPs. Happy to say that today, right, when I first started, we have less than maybe 50 GP partners. Now we have 300 over GP partners across the country. Of course, it's still not enough. There are about 2,000 over GPs in Singapore. We are hoping in the next phase, when the Healthier Singapore is going to incorporate mental health into the primary care at a larger way, we could at least get half of the GPs on board, because it is very important to note that, right? While we talk about mental health, but it does intertwine with physical health very closely. And of course, one of the things that we are trying to do with the aging population, we focuses quite a bit on how to do the integration, health and social care, because about 1 in 10 Singaporean age 60 and above has been, when they do the study, to show that they have dementia. And of course, the depression is about 6%. So it's important then for us to have early identification and bring them on board. What we have done is inside the concept is to take a very population health approach, from living well at risk, whether it's a family history or whether somebody is very stressed out, to those that have mental illness, all the way to how to get them back into the community. After about 10 years, we have managed to have round about 30 community mental health partners, providing more than 90 community programs out in the community. And more than half of our polyclinics in Singapore also have mental health services. And we then twin them with the hospitals, because that's where at times we do need a specialist led multidisciplinary team to provide the support. Of course, I think some of you may be familiar in the university level. There is the community health assessment team that is led by IMH, which is also the national youth team at this juncture, to then see how we could provide better support to the university students beyond your school, counseling centers. And of course, I think at the university now, there's also a lot of awareness, and even at the Office of President, they set up a well-being office, not just for the teachers, but also for the students, to see how else can they better reach out to the students to help them, right, in terms of their mental well-being. Are all this enough? Well, the studies have shown from the Singapore Mental Health Survey 2010-2016 here, as you can see the comparison, things has increased. In fact, significantly, generalized anxiety disorder. And unfortunately, as I shared a little bit earlier on, absolute number for youth and even senior suicide rate has gone up. And that's where, there's a lot of concern about what we should do. In fact, in Singapore, we have a suicide task force that's specifically looking into how could we better prevent and how can we better support for somebody who may have committed or attempted suicide, but, fortunately did not, right, succeed in that. The landscape as well in Singapore, as some of you know, right, we are one of the fastest growing aging population. With aging, there comes the 3 highs: high blood pressure, high cholesterol, as well as high blood pressure, high cholesterol, and high sugar, right? High diabetes, right? So that's where, and we know that chronic illnesses, about 20% of the patients actually have depression or anxiety because of that. And that's where one of the key things is, how can we actually support And then we need to also understand that there's social and health issues get very much intertwined with the aging population, especially. Work stress, early on I mentioned, Singapore take pride of many being the first, right? But unfortunately, this is the top of the list that we are one of the most fatigued countries, right? People are very, very stressed out. Climate change, I think all of you would have heard a lot about climate change, right? In fact, climate change, increasingly, there are studies that shows that there is even direct impact on the mental health. While indirectly, we know that, with air, with the bad airs, with the heat, it does impact the mental health. And the latest projections is that by 2030, it will be about US $2 to $3 billion direct damage costs to health, including mental health. Is it enough? Okay, unfortunately, while we have done many things for the last 10 years, many people still have a little bit of worried stigma. Some are self-stigma, meaning patients themselves stigmatized in terms of their own comfort level, in terms of letting people know. And many of them actually has highlighted that they would like to have anonymous options of care rather than having to tell the name. In Singapore, as you may know, you need consent, right, from your parents in order to seek help. So there's one of the contention issues that now we are seeing. What is it? Unlike in UK, there's a law that, children and adolescents, in their 13s, 15s can actually seek help and nobody can stop them from doing that. So in Singapore, we are still looking into how else and what else can we do to encourage the help seeking. Of course, at the system level, when we talk to many of our GPs, colleagues, there is still issues about they don't know who is the coordinator, because when you want to talk about mental health, there's a social aspect as well. How do we coordinate? How do we even fund? Despite the fact that we have 90 over in terms of the services, but it's still not enough, right? Because the prevalence has gone up. So there are many of the young people who has to go to the private psychiatrist or private clinical psychologist has come and share about the cost being a little bit more too much for them. And some of them find it difficult as well because they dare not tell their parents and they are not working as well. So in short, more needs to be done. And, besides increasing mental literacy, so people to know when and where to get help. And we also need to increase the capacity beyond the professionals. How about the peers, right? From what we understand, many of the young people and working adults seek help when they, need somebody to talk to. That's where the peers are. How do we then involve the public as well? Whether they are in the faith-based group or whether in the community or, whether they are in their gyms and all that. How do we actually help these people to understand better and look out for their friends or their members who may have signs and symptoms of mental health issues? In terms of integration, we also need to look into physical, primary and community care, and of course, more support for the youth and caregivers. Many caregivers feel very, very burnt out and feel very loss of identity, and especially when there's grief and loss involved. They feel very uncomfortable sometimes, to feel guilty about leaving their loved one at home. Of course, stigma is a major issue as well. So what this means is we need to move beyond healthcare to health, taking very upstream, looking out for the mental well-being. And we need to be very targeted and empowering, not just individuals, but families. Many youth has shares, right? A lot of times they dare not tell their parents because they think that the parents don't understand their mental well-being. The parents, on the other hand, get very upset when their youth seek help and not informing of them. So there's a lot of needs for us to see how we could improve the communications, how we could improve the bonding, the relationships between the parents, because it's very important that the parenting and the family support to the youth and the people with mental health issues. And being person-centric means we have to take a live, a live cost approach and looking at the individual strength and not just looking at their illness or their conditions and then, ostracize them. And there's also a need for us to say, how do we involve the youth and the people to co-create solutions for them? So at this juncture, if I may then share, what's the difference really when we talk about mental health and mental illness? As you can see here, it is a spectrum when it comes to mental well-being, right? From well to stress to distress to when you start to have mental illness. And mental illness, as defined by American Psychiatric Association, is basically health conditions involving in changes in emotion, thinking, or behavior, where one is so distressed that they can't function, whether in the social, work, or family activities. On the other hand, mental health is not just about absence of mental illness, but it is a state of well-being where the individual can cope with their normal stresses of life, work productively and fruitfully, and able to make a contribution. Even when they have mental illness, for example, if they are well controlled and they can still cope with their normal stresses, that's where we want to get people to get into that stage. And to do that, then what we need to do is to look beyond mental illness management, to look into how do we start identify, how do we build education, self-care, how do you take care of yourself, how do you know your own boundaries, when do you think it's time for you to let go and not stress yourself, when it's time for you as individual not to be so disturbed, right, by your friends or somebody whom you are not even familiar in the social media talking about, making comments that may not be pleasant. So all those things are in terms of resilience building, early detection is very key for us to help people to build up their mental well-being. How do we do that? There are three main roles that we look at: data collection, digital solutions, and redesigns the way we do things to normalize what is mental health within the redesign of care processes and the support system. When we talk about data and research, I'm sure some of you would know, right? The drivers of health, only about 10% is due to healthcare system. 30% is about genetic, sorry of the spelling error here. 60% is actually social environmental factors. A lot of times we don't realize that. The education, the culture, the religion play a big role. But a lot of times in the healthcare system, we only talk about what can we do? How do we treat your illness? But we forgot you may treat their illness when they go home because of their relationship at home, because of their family, upbringing. They are not able to talk about it and that stress them. And with that stress, it will add on. And that's where you then have relapses and all that. The other part about data is very important is it does also help for better decision making and for the individuals. In fact, there are studies that have shown people with bipolar, for example, right, OCD, now they can use MRI to show, where are the changes, and that helps the individuals to look at, hey, it is not me. Yes, it is my brain. So then they feel a lot more comfortable that it is not like some people say, just snap it up, right? But actually, there are some physiological changes as well. In fact, in a study by involving a longitudinal study from a lady who is pregnant all the way to now, the children are about 10, 11 years old. They start to look at how the mother's well-being and how when the children are brought up, how it affects the mental well-being. For those that 10 to 11 years old now, they have seen a bulk of them. If their mother during their pregnancies are feeling very stressed and not taking care of their own mental well-being, it does affect the children. And I think for some of you who may be familiar, there's what we call adverse childhood events, trauma injuries that affect people as well, whether it's war or whether when you're young, there are some traumatic events, and that has helped. And that has caused some people may have their mental health issues. A lot of times we may not realize. In fact, recently, one of my psychiatrist friends was sharing with us, there's this lady who has been in and out of hospitals for many, many, many years. And she's always been labeled as having depression. But the reality is, finally, on the 9th admissions into IMH, she finally confessed that she was sexually abused when she's young. See, that trauma carries with her all the way for many years. But sometimes we don't realize, we don't go deep inside. And that's very important. So individuals to really understand, how do you help your friends to open up? How do you help your colleagues and your family members? And so for Beyond Healthcare to Health, we are looking at digital solutions. In fact, the World Economic Forum recently shared that, there are different forms of digital mental health, right? From as simple as having the self-guided treatment applications, gamified treatment experiences, to using blogs, podcasts, online assessment, and to now disruptive technology, where people are using AI chatbot, using computerized digital phenotyping, for those of you, right, who may join the challenge wearing the Fitbits and all that, to actually able to collect the data and from there to predict what is happening. So in Singapore, one of the things that we are trying to do is to build a more integrative approach towards the whole digital mental health. From having a digital phenotyping platform, for example, now MOHT is doing a study with INH called HOPES, where we give the patients a digital, digital gadget. And then from there, we try to predict from their sleep pattern and from their how can detect the relapse to help the case manager to reach out to them earlier. We also create this self-help, self-assessment tool called myline.sg. And we have now got myline at work for the teachers as well as for the healthcare clusters and for the public servant. And recently, we also developed a youth myline to see how we could get the youth to come on board to help themselves and to have the peer support system. And of course, our MySGs, our HPB colleagues, they also have a portal that where we have all sorts of resources of mental health. From there, if we could seamlessly connect them, whether somebody can do anonymous or identify to finally get help with a service provider who then can talk to each other to provide a multidisciplinary approach towards helping those that especially more complex cases. Of course, not forgetting our parents and caregivers. How do we then build apps and information portal to help them as well? So beyond digital solution, what else can we do? We need to then look at the policy, because by just having the solutions without changing the policy, without looking at how people can access care will also be not enough, right? In terms of funding as well. And likewise, environment. In fact, if you look at overseas, right, in New York, back in the N20, they talk about population health approach. They talk about redefining best practices and not just face-to-face, but using digital means and to use digital. So there's a difference between digital literacy and able to use social media to help things, right? The digital literacy would means that you need to change the process to see how end-to-end one could better make use of the digital solutions to help them along the way. And of course, in Auckland, in New Zealand, they are very into their population, and they are also believing in going local, go down to the level, not just at the national level, but at the local level, to emphasize on how to help people to build their mental well-being as well. So in Singapore, some of you may know, we have just launched Healthier Singapore. So the idea is about beyond healthcare to health, and that will include mental health. So the first phase will be every Singaporean, every family will have one GPs, and they will focus on chronic illnesses. And by 2023-24, mental health will be included as well. And as a start, the government has also tried to bring the whole community together, because early on we mentioned that there's still a lot of stigma, there's still a lot of people unwilling or uncomfortable to have to work with or deal with people with mental health issues. So there's an interagency task force that's set up, including various partners from all the government agencies and partners, to look into how to develop the overarching strategy and also creating a competencies training framework such that it's consistent and provide a better quality care. And in fact, the task force has just finished their public consultations, so results will be out soon on the various means as to how we can better bring the community together and better support people's mental well-being and people with mental health issues. Of course, for the youth, earlier we mentioned, there's a lot of concerns. So there's a youth mental well-being network that is also being formed, where we involve the youth and the partners to then how to co-create solutions together. Just to share, they've been talked about at the local level, how do we create mental well-being circle so that we can get the whole community to be better support of the individuals while they are in the community as well. Of course, thanks to our top board, there has been funding campaigns since 2018, beyond the label campaign, where we even have a youth alliance, youth-led network to look into what are the various ways and we can better reach out to the youth. Now, beyond all this, at work, earlier on we mentioned workplace, right? Likewise, in the university, as I shared, there have been changes looking at how do we better integrate workplace mental wellness beyond just looking at, giving talks and all that? How do we then start looking at the individuals at the recruitment, at the development stage? And how do we train the supervisors and the individual to be able to take care of themselves, their own needs, and have a balanced life and not being stressed out because of over demand, over expectations by themselves, or from their parents, or from their friends. Those are the things that currently, there is a government in terms of interagency work group as well to look into how else beyond just the physical health, beyond just the safety of the individuals and work group, we could also build in the mental well-being as well. Early on, I mentioned, right, in MOHT, we have built this, what we call MyLife.sg, and we train with the pocket AI therapist called Visor, where one, could have a chat with a Visor. So those of you who like to try, you can type in MyLife.sg. You will see, the Visor is a very AI chatbot, which is emotional intelligence. And you can have, right, many of our users who share that, especially at night, because you can't be seeing your therapist 24/7. So at night, that's where you could actually chat with the chatbot. And also there's resources that teach you how to do, mindfulness, how do you do breathing exercise and all that. And it is anonymous and safe. And there are, now we are looking at how we could seamlessly connect it to the peers of therapists. That's where we created this Youth My Life recently. So there is a Let's Talk forum where youth can come in, where the peers each other can support each other, and there are rooms where one could go in where they are then being supported, facilitated by therapists, where you can then have a closer chat about your own emotional needs as well. Beyond all these things, what about the environment? So early on I mentioned one of the key things we look at is how do we create a framework where we could intersect what is needed for the care and support, understanding the community, bringing the community together, and yet understanding how environment would affect the mental well-being. So that's where we call the healthy precinct framework. And we do know there are many studies have shown natural healing, environment, blue and green spaces are important. So some of you may have heard of people talk about nature walk, people talk about, therapeutic gardens. And then now there's also forest therapy where you can walk along the forest to help you. So there are many different ways of now doing some natural healing. And very importantly, it's not just about the natural healing, the walk by yourself, but also how we could better engage and socialize. How do we build the environment? Even HDB, URA, and all that today, we all come together to look into the new future HDB setup. How do you ensure the setup would also encourage socialization, encourage people to come out to exercise and socialize, and also have environment that can also focus on giving the calm state and help them with their mental well-being. All these things, while it's in place, but there are also challenges, right? There are also issues about funding, and a lot of studies takes time, and we will never have enough number of psychologists. When I first started my journey in IMH, we were having about 150. Today, there are about 400 clinical psychologists, but we're still not enough, right? And looking at, even our mental health services, 90 odd services, but it's still not enough. We still have to build, right? We still need more expertise. And that's why we need to look into beyond that individual. Can we use digital solutions? Can we do self-help, self-tested? Can we empower the individuals and the community to better support them? Of course, there's also a lot of issues. It's about mindset. Many people can say that, yeah, but I'm still not comfortable. I don't want people to know. Even at workplace, while we can tell them the digital solutions is very anonymous. We do not know the name, and you can put in whatever name you want, but there's still fears about their employer. Even in university, we do know, right? And in the primary and secondary school, we do know that children that don't go to student counselors, why? Because they're afraid. Their name are going to be, marked because there's registration. And the parents are also afraid that their kids can never apply for scholarship in the future. So there's still a lot of mindset change that we need to do, how to bring people together and move towards that. So my last slide is calling to all of you. How do we move beyond healthcare to health, including mental health? And can we as pharmacy fraternity ride on this wave? and be one of the key drivers. And while it is important for us as pharmacists to understand the pharmacology, to understand the pharmaceutics of medicines, it is also important for us to start seeing the people we are serving as a whole, as a person who has emotional needs, psychological needs, who also have physical as well as social needs. And of course, importantly, spirituality, the value, the system. So, and not just focusing on giving medication without understanding what actually causes them, what caused the stress, what caused them not to be able to sleep. Why do they, keep to themselves? How can you, as pharmacy future student, future leaders, to help your colleagues, your friends, and reach out to those people whom you serve? Thank you. Hopefully, let's move beyond healthcare to health together as a pharmacy fraternity. Thank you.
Thank you so much, Doctor, for the amazing material. We'll be carrying on the discussion session after the second material. Participants who may wish to can write down the questions in the Q&A box first with the format name_speaker1 or 2 questions.
So let's move on to the second material, COVID-19, lesson learned and moving forward from pharmacist perspective, which will be delivered by our amazing lecturer, Dr. Apoteker Hesti Utami Ramadanianti, Magister Clinical Pharmacy, PhD. But before we start, allow me to introduce our speaker. At 2018, she received the research grant from United Nations of Development Program to review drug pricing in Southeast Asia. In 2020, she receives the Best Oral Presenter at the 3rd Postgraduate Seminar in Pharmaceutical Sciences. In 2020, she also receives research grant from Ministry of Education Postgraduate Research Scheme. In 2022-2023, she receives the research grant from National Institute of Health Research in the United Kingdom. In 2022, she receives the research grant from Health Action International, and she currently working as a lecturer in Faculty of Pharmacy, Pancasila University for bachelor and doctoral program. Before we continue to our material, I would like to confirm, how would you like to conduct the Q&A session, Dr. Hesti?
Well, I don't have any problem if they can raise their hand and then they can ask directly, or they can type their question on the Q&A.
All right, so
anyway, yeah.
The time is yours.
Okay, thank you. Let me share my screen first. Okay. Am I sharing now?
Yes.
Yes, Dr. Hesti.
Okay, thank you. Okay, the Honorable Head of Pharmacy Department of Faculty of Science and US, Singapore, the Honorable Dean of the Faculty of Pharmacy, Universitas Pancasila, colleagues from both universities, committee of the webinar, the dear students, and all participants. I would like to welcome everyone to this collaboration seminar between NUS and Pancasila. And thanks for having me. I'm Hesti Utami. You can call me just Hesti. I'm a researcher and lecturer, and I have major interest in pharmacy practice and pharmaceutical policy. On this special occasion, I would like to share the lesson the pandemic has taught us and the way we can move forward from a pharmacist perspective. Okay, these are the outlines of my talk this morning, and then we start by refreshing our mind to bring back bitter memories through COVID-19 timeline. As we know that in late December 2019, cases with pneumonia-like symptoms arose in Wuhan, China, and by January 2020, World Health Organization concluded that it is caused by a novel coronavirus, which was later named SARS-CoV. And then on March 11, 2020, WHO declared that we had a pandemic. Until March 2020, China had the largest number of confirmed cases, and the following month, United States and Italy began to have the largest number of cases. And then in April 2020, United Kingdom reported having the highest number. And in responding to this situation, let me have the pointer. Yeah. In responding to this situation that all countries close their borders and implement mobility restrictions where all non-essential activities should be done from home. We work from home, we do school from home, and then the restriction has resulted in many impacts, including mental health, like discussed previously by Dr. Moy. And in early December 2020, the nation began to race to secure vaccine, and few European countries started administering the jab to their population. And the question now whether we are at the end of the pandemic, we are not really sure. Hopefully we can see light at the end of the tunnel coming very soon. Okay, one thing we know for sure that about SARS-CoV, it is changing constantly, it keeps mutating, and since the beginning of the pandemic, we have seen a number of the variants, start from Alpha and then Beta, Gamma, Delta, and Omicron. Alpha was the first variant. It appeared for the first time in UK, sometime in May 2020, and the infection surged in December that year. And some mutation in alpha spike protein make it more infectious than the original strain. And some studies suggested that the alpha was more likely to land infected people in the hospital and was deadlier than the original virus. Then the second variant was a beta. It was identified in South Africa in August 2020, and then after that it has spread to other countries. The Center for Disease Control and Prevention in USA said that the beta variant was about 50% more contagious than the original coronavirus strain. After that, we have gamma. So gamma also share the same characteristic as beta, and then it is more contagious as well than the previous variant. After that, we have delta. Delta was first identified in India sometime in October 2020, and then it soon spread throughout the world. And it is estimated that Delta caused more than twice as many infections as the previous variant. Some studies from Scotland, from Canada suggested that Delta was more likely to result in hospitalization, especially for those without vaccination. And then we have the last one, Omicron. There is a lot to learn about Omicron and the subvariants. The original Omicron was first identified in many countries, especially those in African countries, sometime in late November 2021, and the cases quickly began to multiply in other countries. And at the moment, we have subvariant of Omicron, BA5 and BA4. The existing data suggested that the Omicron variant was less severe in general than the previous variant, which is a good news for everyone. And let's see the cases globally. And I refer the report from World Health Organization that until 6th of August 2020, that worldwide we have nearly 600 million confirmed cases with more than 6 million mortalities across the globe. And then when we look at the cases in Indonesia, the COVID-19 pandemic was officially declared transmitted in Indonesia in early March 2020 with the 2 cases. And since the first 2 cases, then the number keeps escalating, keep increasing until now. From January 2020 until 8th of August 2022, we have more than 6 million positive cases and more than 150,000 mortalities. Now we look at some attempts, some measures to control, to counter the disease and to minimize the impact. We start with a partial lockdown. So our government never imposed total lockdown. We implement partial lockdown, and in Indonesia we call it PSBB. PSBB stands for Pembatasan Sosial Berskala Besar or Large Scale Social Restriction. The PSBB has been imposed by our government since late March 2020 to accelerate the mitigation of COVID-19. The regulation involved closing school, closing office, then restricting religious activities and all activities that are done in public places. During the second wave of Delta in July and August last year, the government decided to extend the partial lockdown, leading to the suspension of most activities and the closure of non-essential public places. And then we also implement the health protocol. Indonesian government has launched the health campaign. Initially, we have 3M. Since the beginning of the pandemic, 3M refers to the precautionary action to prevent COVID transmission by wearing masks and then washing hands regularly, either with soap or hand sanitizer, and then maintaining the distance at least 2 meters apart. And then later on, the government has updated the campaign into 5M by incorporating 2 more actions: restricting mobility and then avoiding crowded public places. Then we also implement the strategy called 3T: testing, tracing, and treatment. So one of the most used strategy that can be used to control COVID is by using the 3T. It is designed to control the transmission of the disease by identification of COVID-19 cases, and then tracing the close contact of the confirmed cases, and then afterward, then to advise the patient with no symptom or with mild symptoms to do self-isolation or to get treatment if they develop at least moderate symptoms. And then we also have digital platform for Peduli Lindungi application. So the Indonesian government has been putting its effort to prevent the transmission of COVID-19. Aside from imposing a community restriction, the government also presented Peduli Lindungi, a mobile app initially designed for contact tracing purpose. Since then, some facilities, public facilities like school, university, bank, shopping center require the visitor, the entrant, to scan the barcode, like you can see here, that before we enter the public places, we have to open our mobile, our smartphone, and then open the Peduli Lindungi application and then scan the barcode. And relying on the data sharing of the user location, the mobile app will provide color-coded information about the COVID-19 status of the user. Blacks mean that you get infected. It means that you cannot go anywhere. You have to stay at home. And then red means unvaccinated. Yellow means that you have been vaccinated for the first dose, and means that green means that you are completely vaccinated, and then you are free to go everywhere you want. This application is evolving since its initiation, and it has added some features. Peduli Lindungi mobile can be used to store your vaccine certificate and then to keep the result or your COVID-19 test. It is also integrated with eHealth. eHealth means electronic health alert card for traveling. It is also integrated with other application like SEMA app. It is application developed by Ministry of Health for registration for inpatients, and also it has been integrated with telemedicine app. And the other measure is through vaccination. At the moment in Indonesia, we have been using 8 types of vaccine with different platforms, and our government also is in the stage of undertaking clinical trial for Merah Putih vaccine. Merah Putih vaccine is the vaccine developed by Indonesian government using the strain that obtained from Indonesia. COVID-19 has resulted in many disruption in many aspects of our life, including pharmacy practice. As we can see, especially at the first stage of the pandemic, there is shortage of the supply chains, including medical devices, shortage of medicine, and then PPE, protective personal equipment, and then diagnosis kit, oxygen, and other health devices. We can see this phenomena everywhere. It is not specific to Indonesia. And then the other disruption is because of the increased work pressure. Currently, there is shortage in the number of the doctors, and then nurses, midwives, and pharmacists. With the escalating number of the confirmed cases, the workload of healthcare workers in Indonesia has also been overwhelming, leading to long and irregular working hours, triggering the psychological distress. It has been reported that more than 80% of the health workers in Indonesia experience moderate to severe burnout. The study also found that more than 40% of the healthcare workers, they are emotionally fatigued, they have lost their sense of empathy, and they have lost their self-confidence. And then there is a shifting of service delivery due to mobility restrictions and the fear of getting infection. Pharmacists should make some changes to deliver their service. Amid the pandemic, where in-person meeting with the patient is not feasible, the pharmacists should find innovative ways to get connected with their patient. Some pharmacies have had database of their loyal customer, and they use a range of digital platforms to interact with patients, like using Zoom, WhatsApp message, or other digital platform. And then pharmacists adapted their premises, their facilities to minimize the risk of cross-infection by installing the barrier, just like what you can see here. The pharmacists installing the barrier made from glass or made from plastic, so they can keep social distancing with their customer, with their patients. And also they restrict the number of the customer, the number of the patient that can enter the pharmacy, and also implement delivery service for patients who are undergoing self-isolation. Alongside the facility changes, the work practice changes also happen. For example, the pharmacies close during lunch break, or they separate or they break staff into teams like morning shift and the afternoon shift. And then between morning shift and the afternoon shift, they do not meet each other to avoid any cross infections. So how we deal with the situations? Firstly, dealing with the shortage of medicine and health devices. The pandemic has exposed the fragility of medical supply chains in Indonesia and also in other countries. More than 80% of API refers to active pharmaceutical ingredients for manufacturing medicine, are imported from China and India. And during the COVID-19 outbreak, especially at the first stage, there were travel bans and then export bans and even the factory shutdown that put the significant strain on the supply of medicine and other healthcare devices. So to encourage the actors, the business actors, to support the procurement of the medical equipment, the government has issued several regulations to relax licensing requirements for importation and production of medical devices. The Ministry of Health has also speed up the application process for the licenses required to produce domestically and distribute specific medical devices and household supply to deal with COVID. And the government also offer one-day service for marketing authorization to facilitate the availability of the medicine and other healthcare devices. And in response to Indonesia's current COVID-19 oxygen crisis during the second wave because of the Delta, and then the government has set up a consortium, a partnership between government agency and the private to create and develop oxygen house known as Gotong Royong Oxygen House. So it is a facility to provide oxygen supply, ongoing oxygen supply to people that are suffering from COVID-19, as we still remember that one of the distressing symptoms because of Delta is difficulty to breathe and the drop of oxygen saturation. So that's why there are so many people who they are in line in front of the hospital to get oxygens. So this oxygen house can accommodate up to 500 patients, and it is located nearby, near the COVID-19 referral hospital. If the residents in the oxygen house are getting worse, so they can they can be referred to the nearest COVID-19 referral hospital. And then the other strategy is to provide the hospital either the COVID-19 referral or the makeshift or the emergency hospital. At the beginning of the pandemic, we just have 3 hospitals that are ready to be referral hospital for COVID-19 patients. Since then, the government has prepared many more additional referral hospitals, including police hospital, military hospital, or hospital operated by state-owned enterprises. In addition to COVID-19 referral hospital, the government, through Ministry of Health, also opened the COVID-19 emergency hospital, or we call it makeshift hospital, in many cities like Jakarta, Surabaya, and Batam Island. So the emergency hospital doesn't have critical care facilities. It is mainly for those with no symptom or mild symptoms. For the patient with moderate and severe symptoms, they will be hospitalized in a referral hospital. By March 2020, there are more than 130 hospitals designated as COVID-19 referral hospital. And there is a regulation from the government asking the director of a hospital to convert up to 40% of their beds from the general ward into COVID-19 ward. And then they have to allocate up to 20% of their bed for the critical care patients. And the other thing that Ministry of Health launched a mobile application called Siranap. By accessing the Siranap application, we can check the availability of the isolation bed and ICU in a COVID-19 hospital. Responding to the COVID, Ministry of Health also reviewed and published guidelines for COVID treatment. Up to now, we have 4 editions, the latest one published in January this year. Based on, if you refer to the current guideline, there are 5 medicines that excluded from the previous guideline, like ivermectin, chloroquine, oseltamivir, and then plasma convalescent and azithromycin, because the evidence revealed that those 5 medicines are proven effective for treating COVID. There are 4 antivirals recommended at the moment for COVID: remdesivir, favipiravir, molnupiravir, and combination of nirmatrelvir and ritonavir, or more popular as paxlovid. The guideline also recommends anticoagulant and anti-interleukin-6 like tocilizumab for patients with severe symptoms. As the clinical evidence is still evolving, it is likely that guidelines will be updated accordingly. And the next one is telemedicine for self-isolating patients. As you can see here, this is the website for patients to access telemedicine. Ministry of Health provide telemedicine for patients infected and undertaking self-isolation. So the service can be accessed through this website, isoman.kemkes.co.id, and it can cover teleconsultation and pre-medicine. And in providing the telemedicine service, Ministry of Health has been collaborating with around 17 healthcare platforms like HaloDoc, and then Click Doctor, and then HomeCare24 and others. These are the procedures to get a free telemedicine service. The first one, the patient must take PCR at the laboratory that are affiliating with the Ministry of Health. If the test comes positive, and then the lab will submit the result to the ministry database. Afterward, the patient will receive the message through WhatsApp, and the message is coming from the ministry. And after receiving the notification through their WhatsApp, the patient can have online consultation with a doctor from using the 17 platforms, providing telemedicine service free of charge. They just click the link here, and then they input the voucher code, so it will be free for them. After online consultation, then the doctor will provide digital prescription, and then the patient can upload the digital prescription through the website, and then they can get the free medicine for during the self-isolation. So the government has provided two packages of free medicine for self-isolating patient. The package A is for asymptomatic patient, for those with no symptom. They can get multivitamins. And package B for those with a mild symptom, they will get multivitamins, antiviral, and then antipyretic paracetamol. And the other ways to deal with COVID is to provide the accurate and timely drug and health-related information. Since the beginning of the COVID outbreak, an epidemic of false and misleading information, or maybe popular as hoax, has spread alongside the disease. So it is common that we have heard that wearing masks can inhibit breathing, or COVID-19 vaccine contain microchip, and then you will die within 3 years after you get the jab, or ivermectin is effective for COVID. There are so many false information, hoax that going around. And many people have struggled to find the most up-to-date information, giving some individual the opportunity to benefit by making false claims. In Indonesia itself, the government and its partner are employing different means to address hoax and misinformation. The government has provided the website, the COVID-19 website, and the people can click on hoax buster, and then they can type any keyword to check whether the information is accurate or not. And the Ministry of Information is also working along with the social media platform to take down any hoax, any misinformation, and to take down any accounts or to suspend any accounts which spread the hoax and misinformation. And in this way, of course, the pharmacist as the part of the healthcare professional can play a significant role by undertaking the interpersonal communication with patient and public to facilitate behavior change. And the next one is home delivery of medicine and telepharmacy. As we know that during mobility restriction, the hospital is only for COVID-19 patients. So patients with non-COVID disease, they cannot access hospital. So the most accessible healthcare facilities is the local pharmacy located in their neighborhood, and the most accessible healthcare professional is community pharmacies. So they are accessible 24 hours. They are open during the lockdown. So some studies show that the COVID-19 pandemic has had significant impact on the way we behave, including purchasing behavior, because we cannot go outside, we just stay at home. So we have to order everything using online purchase, including medicine. And the other way to deal with the COVID is through telepharmacy. So telepharmacy is a part of the telemedicine. So in here that the pharmacists can provide their service online. They can provide the drug counseling, and then giving advice on self-medication, and then drug monitoring and drug evaluations. What lesson that we can learn and the way we can move forward? The first one is resilience into medical supply chains. Indonesia has been relying significantly on the import of raw material for medicine and other healthcare devices from other countries, especially from China and India. And Indonesia, to avoid the similar thing to happen, I know we do not expect that the pandemic will happen again, but we have to be very well prepared if something goes wrong, something that happen in the future. So Indonesia government has included production of pharmaceutical product as the part of its development master plan. Some policies and regulation have been stipulated, have been released to facilitate the ability to produce raw materials for medicine and other healthcare devices. And one of the effort is appointing Kimia Pharma Factory. It is a state-owned pharmaceutical company. And Kimia Pharma has been working along with Sungwoon pharmaceutical company from Korea. So they create a collaboration called Kimia Pharma Sungwon Pharmacopoeia to produce medical raw materials since 2016. Up to now, unfortunately, the production still on relatively small scale, so it is not enough to meet the high demand during COVID-19. And the other way is Indonesian FDA, or we familiar with Badan POM or BPOM, has conducted some strategic action to facilitate the drug development and improve public service quality through certification of production facilities and drug registration and improve compliance to good manufacturing practice. And recently, BPOM has launched an application called SIAP UKA, Sistem Aplikasi Uji Klinik dan Praklinik. It is an integrated application for preclinical and clinical trial. So it is expected that this application can ease the registration of preclinical and clinical trials and monitoring of these trial submissions. The other approach is through collaboration between university and industry, facilitated by Ministry of Education. The government has provided a scheme called Kadai Reka, the platform to match the research done by university and the need from industry. So the government through this scheme has provided funding amounting more than 1 trillion rupiah to support the scale up the research product from university so they can be manufactured in large scale in industry. This scheme can benefit industry to avoid any loss during research and development stage. And the way that we can move forward, I focus on the community pharmacies by expanding the legal scope of community pharmacies. As we know that during COVID-19 pandemic, community pharmacies are the most accessible healthcare professional. So it is of beneficial that we have to expand their participation, their role in vaccination. As we know, so far for the COVID-19 vaccination, community pharmacies are not incorporated into the scheme because mainly the vaccination is done by the healthcare professional working in the hospital or working in government-owned primary health centers. So we also encourage the community pharmacies to provide the consultation screening and to be integrated into the emergency response as the part of the healthcare professional. And then by providing the privilege for the community pharmacies for treating and the referral to the patient with common ailment and the more participation in continuity of care for chronic disease. And we also encourage the community pharmacies to get involved in drug monitoring for self-isolating patients. Unfortunately, up to now, what happened in Indonesia that when you undertake self-isolation and then you receive the medicine from the telemedicine, there is no one to monitor the adverse effect that you experience after taking the medicine. So it seems that the community pharmacies have been left out from the scheme. So we do hope that we can learn from this pandemic that to get the community pharmacies to participate deeply into the scheme as the part of the healthcare professional. And then the community pharmacies should provide the electronic health literacy for patient and community, and by giving their service remuneration because of the effort that they have done during the difficult situations. Thanks, everyone. It brings me to the end of my talk today.
Thank you so much, Doctor, for the amazing material. Now we're moving on to the discussion session. Participant who may wish to can write the question down in the Q&A question box below, with the format name _speaker1 or 2 question. We really encourage you guys to ask to the two of the amazing speaker that we have today. So we have one now for Dr. Tan. May I read it for you, Dr. Tan?
Yes, I've actually answer one of them. There's asking about irritability. So I was typing halfway and then I sent off. But I think basically the first thing is to understand, right, what caused the irritability, the root cause behind it. And then, and we all know, right, if you drink too much coffee, sometimes you get too excited, then you don't sleep enough. That can also cause irritability. I mean, irritability could be a sign of depression, but it doesn't mean that it will, right? So I think the main thing is to find out the root cause, what causes that. And then having to then deal with that root causes. If it's stress related, then how do you de-stress yourself? And to help the friend, of course, you must have the relationship and be able to sometimes just be with them, right? And rather than pushing it too much, people may not be comfortable to open up at times. So just be with them, accompanying them and trying to help them. And I think in terms of environment, having a soothing, calming environment, it helps, right? And I think very importantly is we all know, and Singapore is one of the countries, right? Lack of sleep, especially the young one, people like y'all, right? Including, I always tell my son, my son is 27-year-old. We always tell him, you must sleep at least 7-8 hours. Lack of sleep can really cause a lot of problems. And I must say that, at one stage, I was almost burnt out myself as well, because I work, almost like 24/7. That's pre-pandemic, before COVID. So we were doing a lot of community work. Every weekend is burned. And then at night, by the time I go home at 10 o'clock, then you have to clear your emails, and the next morning you have to go to work, So the lack of sleep really changed your personality as well. So sleep is extremely important. Yeah. There's the other question. What can we do to help people with mental health issues as a friend or a family? Okay, so I presume that that this person has been diagnosed with mental health issues, right? I mean, generally speaking, really is just to be there with them, support them, encourage them. If they are, taking medication, make sure they are compliant, because a lot of people do not want to take medication because of the side effects, unfortunately. Yeah. And so then, and some of them, I do have people who may have a little bit of anxiety, and then they have this thinking that, if I take too much of the medication, I get addicted to it, and so of course, there are rules and regulations we put in place so that somebody is not addicted to it, right? Yeah. So encourage them to seek help, and give them emotional listening ears, and then helping them to de-stress, meaning, right, accompanying, go to somewhere for a walk, for a show, doing something that they're happy. Because sometimes one of the major things, especially for anxiety, depression, is that sometimes they, of course, I'm talking about people who already perhaps recovered a little bit and not at a very low state. And they may not want, they want to keep to themselves. Yeah. But I think it's good to just be there with them, listening to them, and do those, and go out with them. Yeah. And if they don't want to go out, they just want to stay in the room, then just, be there with them. I think that is very important. One of the challenge sometimes is as friend, we try to say, let's say somebody boyfriend, girlfriend issues, then I won't say they get to the depression stage, but they are really upset, right? And then you say, never mind lah, you'll find another boyfriend. We try to say things like that. You see all the shows, right? But it may not help. Yeah, just be there and listen to them and getting them to open up and share. And it's okay for them to cry. I always say, right, our culture, right, men are not supposed to cry, but please watch Korean movie, all the men there cry, And I think it's important to cry, right? Because sometimes you do need to express your emotions, not asking you to stand in front of the whole world and cry, right? It's important to express your emotions, and when you're upset, it's okay, right? It is okay to share about why you're upset. So encourage them to do that, of course, in the private, in a private, quiet area. And that sometimes helps to relieve them of the stress, and that will help them in terms of their mental health as well, right? Yeah. But key is really making sure they continue to see their counselors, take their medications, right? See their doctors if needed. Yeah. Okay. And I think maybe I should let there's some questions, right, for Mrs. Utami. Is there?
Is it the second question for me?
There's one question for Dr. Tami from Rika. Yeah. So may I read the question?
Yes, please.
So the question is, as pharmacy student, what contribution that we can do in this pandemic era?
Okay, your students. Okay, I think we have, if you refer to our experience in Pancasila University, that when we have the shortage of the alcohol-based hand sanitizer, we produce the hand sanitizer, and then we distribute to the communities in the nearby the university. That's the one way. And the other way, because you are the pharmacy student, you know more about the drug information, then you can disseminate the valid, the accurate information to people surrounding you. You can start from your family, your relatives, and then your friends, because there are so many misinformation going on during COVID. Like you have to use the necklace that contain the aromatic oil, eucalyptus oil, then you can free from COVID. That's the one of the hoax. Then you can give clarify the false information and then share with your colleagues, with your friends, with your family about the accurate information that you know. That's, I think, some ways that we can contribute as the pharmacy students.
Thank you, Doctor. And then,
yeah, maybe I will answer the two questions together. There was one by Yuniza and there's one by Shakira, right? So quite related. Okay, so when is the right time for us to seek help from professionals? And then there's also the other thing about when do you think that is not normal, right? Yeah. Okay, so there's the thing, right? Earlier on I mentioned mental health is a spectrum. Normalcy is also a spectrum. It really depends on the individuals, right? I always find it amazing when I used to give a talk in one of the polytechnic. There are these course called abnormal psychology. I was telling my friend for psychology, how do you name a course like that? It's so terrible. So normalcy and all these are a spectrum. So first, I think important thing is, as I highlighted earlier on, it is when it impacts you functionally, socially, where there's a point where you don't really, for example, on a daily basis, you don't want to get out of the bed. Now, of course, there are days that we all don't want to get out of bed, right? I don't want to go to school, don't want to go to work, right? Don't want to see somebody because, I have to go to see something. But it really nags on you quite often. And usually we say typically it is more than a week or 2 weeks, okay? But, if let's say it's sudden changes then there may be physical health issues. But if it's no sudden, right, and it's been like lingering, then yes, I think it is important that you then seek help. Yeah. So actually for mylife.sg, so one of the things we've done is we actually embed inside there questions that will help you to do self-assessment, and it is based on PHQ and GAD. So GAD is the assessment for anxiety. PHQ is the assessment for depression. Yeah. So you could, these are some of the questionnaires that can give you something, but please don't go and self-diagnose and say, oh, I have depression. Yeah. A lot of people like to do that, the young one, and not even the young, the old one, right? But actually it may not, but the best is then seek somebody, yeah, to have that professional diagnosis. Because to make a diagnosis is not just looking at you, right, and doing the test, but they will have to ask you about, the time, how long, and what are the issues and things like that, right? Importantly, again, I like to emphasize it's very important to rule out any physical health issues, yeah, especially when there's a sudden change, because those are really treatable and it can be very bad if it's not being treated, yeah. Okay, so that answers also the disorder or not, right? Because it gets to a point where it really affects you, your functionality, your social life and all that, then it is called a disorder. If it is not, it could be you're at the stress or de-stress stage then already. Yeah. So that is the difference in terms of that. Yeah. Of course, that I'm talking about very common mental illness, depression, anxiety. And there's the other group, what some of you may know, right? The psychosis group, right? People with schizophrenia, psychotic, and all that. What we do is when I used to deal with cases in the community, we give this very simple acronym called ABCS. You look at their appearance, any behavioral change, or their behavior, right? It seems to act not so like, a normal person that would kind of restrain themselves. Cognitive changes, right? Meaning, they seems to be able to not, and speech, they are not able to speak relevantly. So that could be a sign of this person may have, right, mental illness. Yeah. And then for dementia, I mean, there are 10 signs and symptoms, but what we did is we came up with something very simple called ABCD. So I like to use all the ABC. A is ADL. They are not able to do their usual daily activities, including bathing or including, forgot to plug in their thing and then they go and turn on the, And then, so B is again their behavior. So some people with dementia, they will withdraw their emotions, they will start cutting off people, and some become aggressive instead, right? C is coordination and cognitive. They are not able to count money properly. They are not able to coordinate, even fall quite often, especially for seniors. And then D is disoriented, whether it's time or whether it's place and things like that. Yeah. So those are some of the simple acronyms that we come up when we go out to do public talk. Yeah. Hope that helps to explain.
Thank you, Dr. Tan. So we really encourage for the participants to ask questions because we have still so many time left, right, Greg?
That's correct. Actually, Dr. Tan, there's been a question in the Google Forms. I'll just read it out to you.
Oh, okay.
So this person asks, do you believe that there's an inertia for institutions, healthcare or educational, for example, to adopt practices and lessons that we have learned during COVID? If so, what do you think? Do you think that there's such an inertia, and is there a way for institutions to overcome it? If not, what can institutions do to accelerate the integration of practices that we might have adopted during COVID?
Okay, if I understand this question correctly, what it is asking is that how can we encourage integration that is happening during COVID? Right? Because usually there's an inertia, right?
Yes,
of people to kind of come together, right? Yeah. Okay, so while it is easy to put the word integration, right? Yeah. But I think my own learning is that there are a few key factors. Number one is really for us to have an integrated system. First of all, I think it's important that we need to understand what are we integrating. It's very easy to say health and social. In what context are we looking at? Are we looking at the context of healthcare, social care, and community care, right? So let's say if I say in the big context, it could be in the context of mental health alone, right? So I use these 5 Ps as a way to help me to guide myself when I talk about collaborating to then design an integrated system, right? So first of all, do we have the first P is purpose. Do we have a common purpose? But when you go down to the ground, let's say when I talk to you, right? So you'll say, solve my problem first, right? So people say, what is the common problem that we are trying to solve, right? Yeah, and then the second part is, do you have people that have the same passion as you, that want to bring these things together, that believes in that when we are trying to do something, we then need to say that we have to be person-centric. And to be person-centric means we as human beings, right? There is the social aspects that we need to address, whether it's relationship, family, or work, or school. And then there is also the health part, which is your physical health, your mental health, right? In terms of the needs, the different needs. And then there's also bringing our daily living is in the community. We cannot run away while we might be working in the, like your study in school, right? And you stay there 24/7, but you actually form a community, right? Out of your class, right? So then if we understand this is the context that we are trying to work with, then what is our mindset? How do we then bring people together? So that leads to that, do you have the third P? Do you have people with a different, the different power to make this happen? Meaning, like for you all to organize this event, for example, right? You need to have the president, and then you need to have somebody who play the secretariat role, right? So there is the what I call the position power. And then very importantly, do you have people who also are willing, what I call, people that are a little bit kepo, don't mind doing the additional, and then wanting to bring people together. And also believing in you are actually empowering yourself. It's okay. Rather than say, oh, I'm not the president, so what can I do? What can I say, right? Do you have that in yourself to say that, hey, can I also bring it up as a suggestions or not, right? So that's the third P. Then very importantly is, do you have the mindset that how do I form that partnership, that collaboration? And then of course, everything takes time. So that's where then, is what I call perseverance to get it done. So in terms of partnership, to make it happen, the principle I always believe in is what I call SOLD, S-O-L-D. So do you have the sincerity, openness to say, this is a learning. To do this integration, it takes time and it is a learning. So SOLD is the determination to come and make it happen. So that's where, so to stop the inertia then, in short, right? First, you need to find the common purpose. What are we trying to do together? It can be big, it can be small, right? It can be small, like just now Mrs. Utami said, right? What can a pharmacist do? If you want, as a pharmacist, well, like she said, right, that when during the pandemic, I knew of a group of pharmacists who go out to the community, teach people how to make, how do you make infection, right? How do you make all those very nice way of helping people to do the hand washing, hand hygiene and stuff like that, right? And because one time we also ran out of hand sanitizer until much more later on. So they actually organized that together with the grassroots leaders and all that. So that is the people that have the passion and have a common purpose, because we want to make sure, we don't all get infected. Yeah. And then this person actually self-empowered, right? Working around and say, oh, not just because I'm not in the community, I'm no longer practicing as a pharmacist, but I go and find friends to do that together, right? And then of course they find partner with the Pharmaceutical Society of Singapore to say, how do we then bring in the other pharmacists together and do a little bit of talk at the same time and things like that. Yeah. So really it calls upon the individual finding the right, the like-minded people to work together. Yeah.
Okay, thank you, Dr. Tan. So we have another question for Dr. Ramadhanianti. Should I read the question?
Is it from Sahla Askia?
Yeah, it's from Shahla.
Yes. Yep. Is it possible that this COVID-19 will be over? So I think there is no one that can answer correctly whether we will be looking at the light at the end of the tunnel. It has been more than 2 years since the beginning of the pandemic. So it is quite tricky to answer when we can see the end of the pandemic, because there are some factors that we have to consider. First, we refer to the principle in pharmacoepidemiology that we have to look at the variants, and then we compare the following variants compared to the original strain. If the following variants are much weaker, and then they result in very mild symptoms, then it is likely that we will be entering the epidemic. Then we will say goodbye to pandemic. But we are not really sure about that. So that's why the researcher up to now are still observing, are still looking at the Omicron variants and what comes next after Omicron. If the next one after Omicron, we have much weaker variants with less severe symptoms that the patient will get. So it is likely that we will be entering the epidemic. So in the meantime, of course, that we cannot just stay at home. So that's why the government in many countries have launched what we call new normal. It means that we gradually to do our routine activities. But on the other hand, that we have to implement some preventive measure. So we still implement the health protocol. It is something different that we have previously. Before we have pandemic, we never wear masks. We rarely use the hand sanitizer, but it is the part of our daily life. So not really sure, Ale, whether we are at the end of the pandemic or not, but we do hope that, finger crossed, that we will see the light of at the end of the tunnel very, very soon.
All right, thank you, Doctor. There are still some time, right, Greg, for the participants to ask questions. The Q&A box is open, so
I saw earlier on there's one asking about studying in Singapore. I'm not sure whether I'm the right person to. Maybe we need somebody from NUS.
I think it's off topic, Dr. Tan.
Yeah. That has to be under NUS. Maybe y'all can channel her to NUS part. Yeah.
Yes.
so if there's any question from the other participants, or maybe the participants who have a question,
Feel free to ask in the Q&A box.
So it's a webinar, so they cannot raise their hand, right? Yeah, unfortunately.
Yeah. Maybe if I can ask, Mr. Sutambi in Indonesia, because now in Singapore, there are lots of concerns really about unfortunate incidents amongst the youth, right?
Yeah.
So stressed out. I'm just wondering, how do you all actually work on in terms of increasing the self-care, taking care, getting the youth to be understanding of there's a need, and a lot of studies have shown social media is one of the major issues, right? Amongst the youth. Yeah, it's good, but it also has the bad side of it. Just wondering, over at your side, what you all do at the university, especially.
Well, unfortunately, we have lack of scheme, to handle with the mental health, especially for the youth. Before the pandemic, in each school they have the service, the counseling service, but it has been closed during the pandemic. So the youth rely so much on their friends, their virtual friends, because they cannot meet their friends directly, and they rely on their family, their relatives to have talk, because they just stay at home. They cannot go anywhere. They cannot go to the cinema or maybe eat in the restaurant. But that's the first year of the pandemic. But for the second year of the pandemic, there is some relaxation. So they can go to the public places, but they have to implement the health protocol. So it seems that the mental health is getting much better than the first year of the pandemic. So we have to admit that lack of scheme for that to manage the mental health for youth. So at the moment that the government has focused so much on the healthcare workers, because they are the front line that are looking after the patients. So to make sure that they have mental health, they are health enough physically and mentally to keep looking after the patients.
Thanks for sharing. Yeah. I mean, certainly in Singapore, well, I think every institutions, the higher learning institutions, has trying to now restructure all their well-being officers to then see how they could reach out. But we also understand on the ground, there are still groups of people who are not comfortable. So as early on, right, one of the participants asked about how do I reach out to my friends, and I think, like you say, one of the best is, being there with them, going out together where possible, and having the chit chat. So that's where one of the things that we are hoping to do. I think our health promotion board actually have training for the young people to be peers. So it's about 1 day training. For those that want to do more, learn more, they can go for another half a day, I think, psychological first aid. So after that, then how do you continue to walk the journey? And importantly also is for those of you who are keen to be peers, I think it's also important to find peer group that can also give you self-care, because sometimes you get burnt out when you talk to your friends and you're also not sure what to do, how to do. So good to link up with the professionals who can also help you and guide you along. Yeah, and of course, you do have to ask your friend how comfortable are they for you to share their issues as well. Yeah. So yeah, I think over the years I learned really self-care is extremely important. Yeah, and having that setting the boundaries and helping yourself. I think that's very important.
Okay, so I think that is it for the discussion session. Thank you so much for Dr. Tan Weng Moy and Dr. Hesti Utami Ramadhanyanti for answering the questions. For now, we would like to invite Safira Salsabila as the Chief Committee of International Webinar Collaboration, SEMA FF-KMUP and NUSPS, to hand out the souvenir to Dr. Tan and Dr. Ramadhanyanti. All right, so the first souvenir will be given to Dr. Tan Weng Moy as our speaker today.
Thank you very much.
Okay, thank you so much, Dr. Okay, for the amazing material. It's so insightful for us as a student, also as a pharmacist. Okay, let me take a picture with Dr. Tan. Okay, 1, 2, 3. Thank you so much, Dr. Tan.
Thank you.
Thank you, Dr. Tan. And then the next souvenir will be given to Dr. Apoteker Hesti Utami Ramadhanyanti, Magister Clinical Pharmacy and PhD, as our speaker today.
Thank you. Thanks for
Thank you so
having
much.
me.
Thank you so much, also. Okay, let's take a picture. 1, 2, 3. Thank you so much, Mrs. T.
Thank you, Safira, Dr. Tan, and Dr. Ramadhanyanti.
Now we'll be playing a game. On your screens, there'll be a code for quizzes, a trivia platform which we'll be using for our game. You can find the link in the chat box. These be named with the format number_name to make it easier for the committee to record winners, and the committee will recognize the winners by their displayed name.
So for the participants, you can just go to your browser and then type www.joinmyquiz.com and then enter the join code, which is 326943.
The link has been just posted into the chat function, so everyone can just go over and click on the link now.
And may I remind you to write the name as number_ your name to make it easier for the committee to record the winner. So we're still at 52 participants, right, Greg? And we have 264 participants. So please join the quiz with the link provided below.
For those who have not clicked on the link yet, please go to the chat function and click on the link. The code for the quizzes will be 326943.
All right, we will wait some more so all the participants could join the quiz. So how many participants on the quizzes committee? Is it still 52?
Yeah, attractive prizes to be won, so please don't be shy and join the game.
Oh, right. So it's 153 now. So should we just start the game? All right, maybe we will wait until 10:50. Is that okay with you, Greg?
Sure, there's still time, so
Yeah, so we will wait until 10:50. So all the participants hopefully already joined the quizzes. By then, you can just click on the link that is given in the chat function to join, and then rename your name as number underscore your name. I saw here there are a lot of people that do not follow that rule, so
yes, please rename your name yourself so it's easier for the committee to recognize the winners later on.
yeah. Two minutes left. Let's pick up the pace here. So we are in 181 now. If you notice that your name format is still wrong, please change it first before you playing, because we still have time until 10:50. All right, so let's start. right, so now we have our winner, but we will announce that after we watch some video presentation from Faculty of Pharmacy of Pancasila University and the National University of Singapore Pharmacy Society. We also have a lot more exciting prizes for the amazing participants today, so stay tuned.
Ladies and gentlemen, now let's move on to our next agenda, which will be video presentations from National University of Singapore and Pancasila University. We will first play a video from Faculty of Pharmacy of Pancasila University.
Sudah lebih dari 5 dasawarsa berdiri. Universitas Pancasila terus berinovasi, bertransformasi untuk menjadi salah satu universitas terbaik di tingkat perguruan tinggi swasta di Indonesia. Didukung oleh fasilitas yang lengkap dan modern, serta sumber daya manusia yang berdedikasi tinggi. Universitas Pancasila telah berpredikat perguruan tinggi swasta yang memperoleh akreditasi institusi A oleh Badan Akreditasi Nasional Perguruan Tinggi, di peringkat nasional pada tahun 2019 menjadi peringkat 45, dan dalam konteks Green Metric kami mendapat peringkat 29. Dan kini terus memegang teguh komitmen dalam pelaksanaan Tridharma Perguruan Tinggi. Kami terus melakukan inovasi-inovasi, pembaharuan kualitas dan kapasitas, sehingga pada akhirnya akan memberikan suatu layanan terbaik pada lembaga pemerintahan, dunia industri, dan kepada pemberdayaan masyarakat pada era digitalisasi.
Berada di lokasi strategis paling selatan Jakarta, Universitas Pancasila banyak memiliki kemudahan akses. Salah satu akses unggulannya adalah moda transportasi kereta api berlokasi tepat di depan Universitas Pancasila, sehingga efisiensi menuju lokasi menjadi mudah. Selain keunggulan akses dan sejalan dengan UI Green Metric, Universitas Pancasila hingga kini terus melestarikan dan tetap menjaga konsep ramah lingkungan. Salah satu kebanggaan Universitas Pancasila adalah memiliki salah satu fakultas farmasi swasta terbaik di Indonesia yang sudah berdiri sejak tahun 1964 sebagai fakultas farmasi swasta pertama dan terbesar di Indonesia yang telah terakreditasi A oleh Badan Akreditasi Nasional Perguruan Tinggi. Saat ini, Fakultas Farmasi sudah memiliki 5 program studi, di antaranya program studi D3 Farmasi terakreditasi B, program studi Sarjana Farmasi terakreditasi A, program studi Profesi Apoteker terakreditasi A, program studi Magister Ilmu Kefarmasian terakreditasi B, program studi Doktor Ilmu Farmasi terakreditasi C.
Fakultas Farmasi Universitas Pancasila berfokus melaksanakan Tridharma Perguruan Tinggi yang bermutu tinggi untuk menghasilkan lulusan tenaga kefarmasian dan akademisi bidang farmasi yang kompeten dan profesional. Penelitian dan pengabdian kepada masyarakat yang bermutu dan berhasil guna, serta menjalin kerjasama dalam negeri dan luar negeri yang saling membangun. Sesuai dengan visi Fakultas Farmasi Universitas Pancasila, yaitu menjadi perguruan tinggi farmasi unggulan yang bertaraf nasional maupun internasional berdasarkan nilai-nilai luhur Pancasila.
Dalam menunjang dan mendukung kegiatan akademik dan non-akademik Sivitas Akademika, Fakultas Farmasi yang akrab disebut dengan Gedung Ungu ini juga telah dilengkapi dengan berbagai sarana prasarana, di antaranya Pharmacy Corner sebagai tempat mahasiswa berkumpul dan berdiskusi, dilengkapi dengan fasilitas Wi-Fi, aula Fakultas Farmasi, ruang rapat Fakultas Farmasi, ruang satuan jaminan mutu, ruang bagian umum, kepegawaian, dan keuangan, ruang bagian akademik, ruang pusat pengolahan data, ruang unit penelitian dan pengabdian kepada masyarakat, kantin dan koperasi, lapangan olahraga. Secara struktural, Fakultas Farmasi memiliki ruangan di antaranya ruang dekan, ruang wakil dekan 1 yang juga sebagai ketua program studi sarjana farmasi, ruang wakil dekan 2, ruang wakil dekan 3, ruang ketua program studi dan staf profesi apoteker, ruang ketua program studi dan staf magister ilmu kefarmasian, ruang ketua program studi doktor dan staf ilmu farmasi, ruang ketua program studi dan staf D3 farmasi, serta ruang dosen D3, S1, S2, dan S3. Fakultas Farmasi Universitas Pancasila melayani seluruh elemen masyarakat, mulai dari kalangan industri, akademik, maupun perorangan, melalui laboratorium jasa pengujian QLab yang telah tersertifikasi ISO 17025-2017 dari Komite Akreditasi Nasional. Secara teknis, ruang lingkup pengujian QLab meliputi kimia dan farmasetika, mikrobiologi, dan farmakologi. Fakultas Farmasi Universitas Pancasila juga memiliki pusat kajian kebijakan, manajemen, dan pelayanan farmasi yang saat ini dipercaya menjalankan proyek kerjasama dengan Erasmus School of Health Policy and Management, Rotterdam, the Netherlands, United Nations Development Program, serta di tingkat nasional di Kementerian Kesehatan. Sebagai bentuk konsistensi dan perluasan infrastruktur, Fakultas Farmasi Universitas Pancasila juga merencanakan tahap pengembangan gedung baru yang berfungsi sebagai teaching factory, laboratorium kosmetika, bioteknologi, serta bioavailability dan bioequivalency.
Program studi D3 Farmasi Universitas Pancasila memiliki visi menjadi program studi D3 Farmasi unggulan dalam memenuhi kebutuhan industri dan pelayanan farmasi berdasarkan nilai-nilai luhur Pancasila. Kurikulum program studi D3 Farmasi Universitas Pancasila disusun berdasarkan kurikulum inti D3 Farmasi ditambah dengan kurikulum khas institusi, berpedoman pada standar capaian pembelajaran sesuai kerangka kualifikasi nasional Indonesia dan standar nasional pendidikan tinggi untuk membangun kompetensi lulusan sebagai tenaga teknis kefarmasian yang kompeten dalam produksi, distribusi, pemasaran sediaan farmasi dan alat kesehatan, serta pelayanan kefarmasian.
Beberapa fasilitas penunjang pembelajaran program studi D3, di antaranya ruang kelas yang nyaman dengan pembelajaran teknologi yang mutakhir. Mahasiswa Prodi D3 Farmasi Universitas Pancasila juga mengikuti beberapa kegiatan praktik kerja lapangan, antara lain industri farmasi dan pedagang besar farmasi seperti Sanofi Aventis, PT Hyphen Pharma, PT Pro Health Internasional, PT Abbott, PT Sunti Sepuri, PT Kebayoran Pharma, PT Encefal Putra Mega Trading, fasilitas pelayanan kefarmasian seperti di Rumah Sakit Umum Daerah Pasar Minggu, RSUD Pasar Rebo, Apotik Kimia Farma, dan Puskesmas di wilayah Jakarta Selatan. Juga ikut serta dalam program magang mahasiswa bersertifikat BUMN di PT Kimia Farma Persero, PT Bio Farma, dan PT Indofarma. Berkontribusi memberikan pengkayaan wawasan melalui kegiatan seminar, kuliah lapangan, kunjungan industri, dan kuliah tamu dari para praktisi yang ahli di bidangnya. Pada tahun 2018, Prodi D3 Farmasi bekerja sama dengan PT Tempo Media Group menyelenggarakan seminar Temukan Ide Bisnismu untuk menginspirasi mahasiswa membuat startup bisnis. Dosen dan mahasiswa Prodi D3 Farmasi Universitas Pancasila secara aktif melaksanakan kegiatan pengabdian kepada masyarakat, seperti mengenalkan dunia farmasi dan tumbuhan obat keluarga kepada siswa sekolah dasar di Sekolah Alam Indonesia Meruyung Depok, edukasi tentang kesehatan reproduksi remaja di SMPIT Al-Haraki Depok, berkolaborasi dengan Fakultas Teknik Universitas Pancasila dalam kegiatan Pancasila Mengabdi di Desa Luwisadeng, Bogor, Jawa Barat dengan memberikan pemeriksaan kesehatan gratis dan penyuluhan kesehatan. Program studi D3 Farmasi bersama dengan Fakultas Farmasi Universitas Pancasila memfasilitasi para lulusan untuk memperoleh pekerjaan melalui kegiatan open recruitment yang diselenggarakan 2 kali dalam setahun, melibatkan para pengguna lulusan dari industri farmasi, PBF, rumah sakit, dan apotek. Untuk meningkatkan kompetensi dan pembekalan lulusan agar siap bekerja, Fakultas Farmasi Universitas Pancasila bekerja sama dengan Lembaga Sertifikasi Profesi Universitas Pancasila dan Badan Nasional Sertifikasi Profesi (BNSP) menyelenggarakan sertifikasi kompetensi bagi mahasiswa program studi D3 berupa sertifikasi skema dispensing farmasi di farmasi komunitas di tempat uji kompetensi apotik farmasi Pancasila. Pada akhir masa studinya, mahasiswa Prodi D3 Farmasi Universitas Pancasila mengikuti ujian kompetensi tenaga teknis kefarmasian Indonesia secara nasional untuk memperoleh sertifikat kompetensi dan diambil sumpahnya sebagai seorang tenaga teknis kefarmasian. Sehingga lulusan Prodi D3 menjadi ahli madya farmasi, tenaga teknis kefarmasian yang kompeten dan legal dalam menjalankan tugas keprofesiannya. Berdasarkan data Tracer Study tahun 2019, lulusan program studi D3 Fakultas Farmasi Universitas Pancasila cepat memperoleh memperoleh pekerjaan dengan masa tunggu setelah lulus rata-rata adalah 2,5 bulan dan kesesuaian pekerjaan dengan bidang kefarmasian sebesar 86%. Sebanyak 18% lulusan program studi D3 Fakultas Farmasi Universitas Pancasila terserap di perusahaan farmasi multinasional dan selebihnya tersebar di berbagai industri farmasi serta fasilitas pelayanan kefarmasian di seluruh Indonesia.
Program studi D3 Farmasi Universitas Pancasila siap untuk berkontribusi dalam memajukan bidang kesehatan di Indonesia melalui kegiatan Tridharma perguruan tinggi yang bermutu tinggi serta mampu bersaing dalam memenuhi kebutuhan pengguna di bidang industri dan pelayanan kefarmasian serta beretika moral Pancasila.
All right, what an exciting video. So the next video we'll see is from the National University of Singapore Pharmaceutical Society. So please enjoy, you guys.
Amazing videos by Pancasila University and National University of Singapore Pharmaceutical Society. Now we are ready to announce our winners for today. From the game session, we have 6 winners. They are number 1, Alfami Thessalonica. Number 2, Goldie Mon Bernaldi. Number 3, Amalia Zara. Number 4, Fabiani.
Number 5, Shafan Nur Hamidah, and number 6, Elsa Aprilianti. But don't worry, guys, we also have 4 other winners for the best question category. So congratulations to Kanita Hilmania, Lau Yuteng, Rika Ramawanti, and Shahla Azkia. So congratulations for all the winners, and please contact our team shortly after this event.
We have come to the end of our event. Hopefully you have found this event informative and learned a lot by participating in this webinar. For the committee, let's turn the cameras on before we end our agenda today.
And also, we would like to thank all the participants for taking your time off your busy schedule to join us in the international collaboration SEMA FF-KMUP and NUSPS today.
Ask Greg
and Alessandro.
On behalf of the Committee of International Webinar Collaboration, SEMA FF-KMUP, and NUSPS, we would like to apologize if there were some mistakes that happened along the way, and we hope to see you all in our next event.
Goodbye.
Sorry guys, before we leave, let's take a picture.
Okay, sure. Okay, let's all the committees please turn your cameras on and take a picture together.
Let me take a picture for documentary purposes. And first slide. 1, 2, 3. So for the second slide, 1, 2, 3. Okay, thank you.
Okay, thank you, Ernst. And thank you for the committee and all the participants joining today.
Okay, thank you so much for MCs and all the committees from SEMA FF-KMUP, also from NUSPS. Thank you so much as well. Thank you so much, guys. I'll see you guys on our next event. Bye, guys.
Bye, guys. Thank you very much.
Thank you.
You guys.
Thank you.
you.
Thank you, guys.